Hello, everyone. Good afternoon. My name is Bex Hayhoe, the Executive Director for United to End Homelessness with Orange County United Way. We are very excited for today's session. And as you join us, we would like to encourage you to please fill out the pre-event survey that should be popping up on your screen. Thank you so much for attending today's event, and for participating in this year's 4th annual Hunger and Homelessness Awareness Week. In March of this year, the Secretary of the U.S. Department of Housing and Urban Development, Marcia Fudge, said that housing is a human right, something that no other secretary has said before. And this is what sparked the focus for this year's Awareness Week campaign. 26 different agencies have come together to plan the activities that are happening this week to give every Orange County resident the opportunity to think about their beliefs of housing as a human right. And today you're going to hear from leaders in different sectors talk about how they view housing, its role in a community, and their thoughts around Secretary Fudge's statements. Before we dive deep into the discussion, I'm delighted to say that we have video remarks from Jason Pooh, the HUD Regional Administrator for Region 9, which is the region that we're in here in California. These remarks are going to touch on Secretary Fudge's statement and provide context for the work that HUD does.
Hello, friends and partners at Orange County United Way. I'm Jason Pooh, HUD Regional Administrator for Region 9, covering the states of Arizona, California, Hawaii, Nevada, and the Outer Pacific Islands. Thank you for the invitation to participate in this virtual discussion, Is Housing a Human Right? I am very excited to provide remarks on behalf of HUD Secretary Marcia L. Fudge. And to the very question you now pose, Secretary Fudge says, if we are to fully achieve justice in housing, we must fully accept what that means. Justice in housing is everyone realizing the fundamental truth. Housing is a human right. Safe, stable, and secure housing has many intersectional impacts on our lives. It impacts our physical and mental health. It impacts the education of our children. It affects our employment and economic opportunities. And that is why we at HUD are doing everything we can at every point on the economic spectrum to address homelessness and housing affordability. From rehousing the homeless and providing wraparound services through the Housing First approach, to preserving and expanding our stock of affordable housing to assist the unsheltered and prevent further homelessness, to boosting the overall supply of housing, to equalize supply and demand and reduce housing costs for all Americans. Thank you to the Orange County United Way for the continued partnership in this shared mission. I applaud your United to End Homelessness initiative and your commitment to achieving functional zero for your families, youth, veterans, and seniors. Housing first does not mean housing only, though, and we know that homelessness is not just one thing to address. Decades of underinvestment in housing and services have created a steep mountain to climb. But with the historic resources made available by the Biden-Harris administration to address these issues under CARES and the American Rescue Plan, we can and we will climb this mountain together. We all have a once-in-a-lifetime opportunity to make a tangible and measurable impact on homelessness and housing affordability. We look forward to our continued work together to bridge these gaps and ensure housing as a human right. Again, thank you and your partners for being allies in this fight. We look forward to continuing our work together.
So thank you to Jason Pooh for those remarks. It's important to acknowledge how the discussion that we're having today connects to these topics of housing affordability, homelessness, and work that is happening across the nation. You heard Jason mention how housing has many intersectional impacts on people's lives, how it can influence someone's physical, mental health, someone's agency, dignity, and opportunities. And this is a great way to jump into today's discussion and unpack the role that housing has in people's lives and what that means for the way we see it. So I'm delighted to say that our first guest today is John Gould, the Dean of the University of California, Irvine School of Social Ecology. John's incredible expertise covers justice policy, social change, and government reform. He's written 5 books and more than 100 articles and has been the senior policy advisor in the U.S. Department of Justice and director of the Law and Social Sciences program at the National Science Foundation. He has a wealth of knowledge that we're excited to hear from today. So John, first question for you. What is it about this topic that excites you and why did you want to join this discussion?
Well, Bex, thank you very much for including me I am really delighted to be here. So there are two reasons why I'm particularly interested in being here. One is being the Dean of the School of Social Ecology, which really has two very distinctive features to it. Number one, we don't just study social problems, we try to help solve them. And then we do it in an interconnected way. We say that if there are social problems that need addressing, they have to be done in a way where we're really being connected, not only among a number of different research histories, but also by being connected with those in the community, policymakers and practitioners. And if there were ever an issue that required this kind of coordinated response across a number of different disciplines and between researchers and practitioners and policymakers, it would be homelessness. Now, I come to this issue from a little bit of personal history. When I first became a professional, I was a lawyer to begin before I went back into academia. I volunteered in Washington, D.C. with an organization called the Washington Legal Clinic for the Homeless. And I had a number of clients at that time who were on a pro bono basis who were homeless. And what I saw was how easy it was for people to fall into homelessness and the many consequences that seemed to snowball for them from being homeless. I also saw the many challenges that were involved in trying to help people address their situations and also to prevent it. So this has been an issue that has been front and center for me for a lot of my own professional career.
Thank you so much for that introduction. So, bearing in mind both your kind of personal experience as well as the incredible history and expertise you have in the realm of academia, what are your initial thoughts on Jason Pru's remarks regarding housing as a human right?
So I think that is a profound change in the government response. We have heard before in other administrations that housing is important, and indeed, of course, it is important, but we haven't seen someone at the level of a secretary of a department call it a human right. Now, we have not seen the president or the vice president yet say it's a human right, but to have that kind of statement come out of the administration is profound. And I'm delighted to see it. At the same time, excuse me, at the same time, it gives me a little bit of pause because I worry about whether there are some who are going to gloss over this statement as that's the be all end all when we know there are so many challenges here. So, of course, one of the things that needs to be done is that we need to see more building of affordable housing. And it needs to go into all kinds of communities. It cannot be simply targeted to particular areas and not others. So, of course, building affordable housing is perhaps the number one priority. But as I said earlier, I'm a little concerned that it not gloss over some of the other things that we know about homelessness and what makes it so difficult to address. For example, the difference between episodic homelessness and chronic homelessness. We also we know we need to be focusing on the root causes of homelessness, and that brings in many other issues from mental health challenges to alcohol or drug addiction, domestic violence, whether people have a solid education on which to build a professional career, what hourly wages are, what the economy is like at a given time. Many of those problems we know got worse during the pandemic. So it is, again, very important and a huge step forward that we're seeing the administration say that housing is a human right. And I'm delighted. But this needs to be the beginning of a larger dive into the many facets of homelessness. And I'm hoping that we will see a commitment to those problems that need to be addressed, that commitment really be followed through upon.
Thank you for that. That leads me beautifully into my next question. So, from your experience, when an entity does declare something as a human right, how does that impact an issue or a situation?
So my students who've taken my courses before know that I say that we oftentimes think of rights as law, but they're really about politics. Now, that said, the United Nations has said that housing is a human right, that it's part of the adequate standard of living that appears in both the Universal Declaration of Human Rights and the International Covenant on Economic, Social, and Cultural Rights. So that's good. The United Nations made that statement. Now, has that led to the end of homelessness? No, and we know that. So if rights are as much about politics as they are about law, that raises the question of where do we go from here and who's going to advocate here? So let's think about what the perfect world looks like. So the perfect world is that the secretary has said housing is a human right, that the rest of the administration gets behind this and wants to see it codified. We see it either codified in, say, an executive order, or, as long as we're going to dream here for a moment, Congress comes back into session, whether later this month or a new Congress, and says, you know, you're right, Secretary. Human rights, housing's a human right. We need to codify it, and we then need to we need to appropriate a lot of money to deal with this. That then filters down into the communities. We see more affordable housing built. We see a number of these other issues, drug and alcohol addiction, mental health, hourly wages. We see those addressed, and off we go. And then I wake up from this dream, because that's not going to happen. So we need to think about what's realistic. Where do we go from this, and what can we do from it? It strikes me that the statement is a commitment that advocates can try to hold this administration's feet to the fire on, so that we are seeing that discretionary funds that are potentially in HUD can be sent out to help with the kinds of things that I've already talked about before. We can see potentially some states pick up this mantra, that take the baton and really run with it, because now there's actually some more federal support for the idea. I think the reality is that those of us who care about these issues are going to still have to work as hard, if not harder, on the ground to see all of this come to a reality, because there are a number of people on the other side that either, well, it's not even another side issue. This isn't two sides. This is an issue where I don't know that there's a lot of appreciation among the American people of the fact that homelessness can be addressed. I think there are a number of people who kind of look at their communities, they don't like what's happening, they throw their hands up. We need to tap into that frustration on one hand, and the statement of the right on the other, and use that for advocacy, but also action to ensure that we're really at the local level trying to drive as much support to a number of these measures as possible. So I guess what I am saying in the end is that I am very pleased to see this statement. I am hopeful that it gives those of us who care about this issue additional gravitas in moving things forward, but by no means do I think the world has changed overnight because of the statement.
Thank you so much for that insight. I think that's definitely one of the things that I've personally been very curious about. Is delighted, that Secretary Fudge has made these statements, but very curious about what we might see rolling out over the next few months and years under the current administration as it comes to, actioning this statement. And then I just would love to hear your personal thoughts about housing as a human right. What is your opinion on this subject?
So I think if we are living in a civilized society, and I'd like to think that we are, that there are certain essential prerequisites that need to be provided for people to be able to survive in a society. At the very least, someone needs a house. At the very least, someone needs access to an adequate education. I think we also want to see a society in which we stamp out hunger. So those are some of the most basic prerequisites. When people say things like that, sometimes there is an objection, oh, that's the rise of socialism. I don't think that's socialist at all. What we're talking about in these situations is we are talking about providing a baseline so that people really then get a fair chance at following their own path to opportunity in the society and to success. So without a house, or without any sort of housing, how is a child going to learn? How is anyone going to be able to have a job where there's nowhere for them to go and sleep at night? How is someone going to adequately participate in society? I don't see that happening. So again, to me, housing is an absolute essential building block for people to be full participants in a society, to reach their greatest potential, and hopefully to be the economic success that we all want to see them be, so that homelessness and housing do not become issues for them going forward.
Thank you so much for those insights. And then if you have any final thoughts, this is your moment. What else would you like to say about the concept of housing as a human right?
So it's not so much about housing as a human right, but rather, Bex, what you're doing here today, which is so important. These problems are not going to be addressed adequately if we simply say, oh, we'll leave it to this organization over here, or it's this field over there. We didn't get to homelessness overnight by it simply being one problem that caused it. We have a number of different problems, as I mentioned earlier, that interact to give us a situation where there is homelessness and hunger in the United States. We need to have solutions here that involve many of us from a whole lot of different perspectives, from different disciplines, from different parties, from different ideologies, all kinds of differences. We all need to come together on this, because I am certain that there is no one in this society that is in favor of homelessness. And as you travel the world, you travel American cities and you see this, it's incredibly troubling on a societal level, on a policy level, and a personal level. And again, I want to commend you for bringing people together, because it's organizations like yours that can be the umbrella to help many people work together on this.
Thank you so much for your insight and your perspective that you've been able to bring to today's conversation. You've definitely left me with a lot of things to think about, as I'm sure you have everybody that has tuned in. And as you mentioned, it's really important to think about this from different perspectives. And so I'd now like to welcome some other figures to give their perspectives on this discussion, in particular from the faith and the public health world. So thank you so much, John, for joining us.
Oh, my pleasure. I was pleased to be here.
So I'm really excited to be able to welcome Christy Wimber to join us today. Christy is an author, a former senior pastor, an international speaker who has been speaking around the world on leadership, mental health, and building healthy communities for decades. She's built various ministries while leading a church for over 11 years and brings a really unique perspective to our conversation. So welcome, Christy. Happy to have you here today. And I'm also thrilled to be able to have Dr. Zoe Freggens with us today from the Centers for Disease Control and Prevention, the Office of Minority Health and Health Equity, as their ORISE Fellow. Dr. Freggens has researched a wide variety of topics, including birth-related medical care, health identities, and health impacts, and they're currently focusing on the structural factors that shape social life and contribute to health inequality. She received her PhD and master's from Georgia State University and her BA from Salem College. So welcome to you too, Dr. Freggens. So we're just going to dive straight in here this morning. What are your initial thoughts on the remarks that we heard both from HUD and from John? And Christy, I'll come to you first. Absolutely. We got a slight technical problem here. So Dr. Freggens, I'm going to come over to you. Would love to hear your thoughts on those remarks.
Sure. So first off, thank you so much for having me. It's an honor to be here. Housing and health are inextricably linked. And so I think a lot of what Jason and John have said, relate to all of these intersections and to public health specifically. Stable, safe, affordable, and accessible housing provide the conditions necessary for favorable health outcomes. And so when people experience unstable, unsafe, unaffordable, or a complete lack of housing, these adverse conditions negatively affect health and can have both short and long-term consequences. And so I think a lot of the things that have been stated thus far are critical to think about in tandem. And all of these factors and the complexity of these factors will help us in terms of health and finding solutions to these social problems. Because as humans, we have a fundamental physiological and psychological needs that must be met, which many of which are met via safe and secure housing. Protection from the elements, clean water, adequate light, and so on. So I think that the statements that have been made thus far are important and contribute to this larger issue.
So, Dr. Freggens, I would love to do a bit of a deeper dive into this. I think we saw during the pandemic the real correlation between housing and health. And so, from your perspective, from the world of public health, how is housing viewed? If you could just take us into a deeper journey into looking at that.
Definitely. You mentioned COVID-19, and that crisis has offered a critical reflection point for us. Public health, has made little progress in reducing health disparities and inequities despite efforts and resources, in part due to a focus on, primarily individual knowledge and behavior versus on the structures and social context driving the disparities. A lack of systems, tools, and resources for monitoring and leveraging those structural and social determinants of health, and challenges in establishing and sustaining community-driven collaborations, working with community to work through these issues. And if we can approach, health equity concerns, including housing and that strong relationship between housing and health, we can help start to alleviate those issues if we kind of look at all of that context. And the aim is to fill in gaps by first focusing on social and structural contexts rather than solely the individual risks, behaviors. And so by, taking that approach, we have an opportunity to alleviate a lot of these issues.
Wonderful. Thank you so much for that insight. And it looks like we have Christy back with us. So, Christy, I'm going to come over to you for your initial thoughts on the remarks that we heard from HUD and from John as well.
Yeah, Bex, thank you for having me. I think it's brilliant that we're having this conversation. I think what you're doing is like the beginning of, I think if we're not having the conversations, and not just the conversations, but also, it kind of sets a table for us to not just talk about the things that have kind of been the message from the video, as well as John's remarks, and even what Zoe just said, is how important it is that we're not just each talking about these things, but committed to working alongside. And I think that's key. And I heard that in each thing that's said, and that is what really, kind of creates and helps build into our health, body, soul, and spirit. So it's not just having the conversations, but it's also the willingness and the commitment, which sounds like that's beginning to happen. And that's when we can begin to see a much needed change.
Thank you so much, Christy. In your faith tradition and your own experiences, is there a spiritual value that's placed on having a home?
I mean, how can it not be? I mean, I believe, that we're spiritual beings. So like, how can it not affect my health physically, obviously, but also mentally as well as spiritually. I think most things are all spiritual. And so absolutely, I see housing as a spiritual issue, not just a physical one. It just kind of brings in so many other layers. When we're talking about having a place of safety, having a place where there's dignity, having a place that where there's an environment where you can really have health and wholeness and grow. I think all of those are very spiritual.
Absolutely. And Do you think housing is something that is talked about in the faith communities, or is it more something that's sort of just taken for granted and is kind of a given?
I'm gonna be honest. I don't think the church talks about it enough. I think that we tend to like, well, that's the government's problem, and I approach housing as this is part of the well-being of someone, and so I don't think the church talks about it enough. And I think we tend to, because I am the church, so I can say this is that, I whatever we hand off to other entities. That I feel like we're not doing what we're supposed to be doing. And I absolutely believe that we need to not only have these conversations, but they need to be a byproduct of even why we are a church. That's how important I think it is.
Thank you for that. And building kind of off that, Dr. Freggens, I'd like to come to you and talk about the impacts on health when someone doesn't have a stable home.
Definitely. So there are several aspects of housing or lack thereof that impact health, including affordability, stability, quality, and safety, and the surrounding neighborhood. So one such aspect is the quality of housing, specifically the physical quality of housing and neighborhood conditions. And this quality refers to the physical conditions of a person's home, as well as the quality of the social and physical environment. So, poor quality housing is associated with various negative health outcomes. And experiencing housing insecurity or, housing affordability stress negatively impacts mental health as well. And negative impacts are significant regardless of baseline mental health. So, similarly, prolonged fear of eviction is also associated with increased mental health burden. Research illustrates the odds of depression, anxiety, and prescription medication use in an at risk eviction group were significantly higher than in the study's reference group. Um, home design and structure significantly influence housing quality and, again, mental and physical health. And so, lead paint exposure, poor air quality, overcrowding, all of these things have documented effects on health that we know exist and occur, and we've known for some time.
Mm.
Thank you. Christy, I can see you nodding along to some of that. Is there anything that you wanted to add to that around that connection between health, housing, and bringing spirituality into that?
Like I said, Bex, I think what Zoe's saying is so good. I think it all matters. And I think even what she's saying about the condition, it's not just having a house, it's the conditions of the house. And then also the conditions of outside of the house, but also inside of the house, the safety, all of those different layers that all affect the health and the well-being of a person. So I absolutely agree with her. I think all of these things are so important. When we're talking about housing, it's layered, isn't it? And I think knowing that is really important.
Yeah, I think this is part of why I'm so excited to be having these discussions today. I think for most of us, if we haven't experienced housing instability ourselves, we don't pause to think about this. And so it's not until either something happens to us personally where our home is at risk, or it happens to a friend or a family member or somebody who we know. When they experience this, it sort of brings home to us how important having a home and a safe place to be your base is for every aspect of your life. So I'm going to ask each of you kind of the gold question here, the question that's on the table for the week. Do you see housing as a human right? And Dr. Freggens, I'll come straight to you. And what are the reasons behind your answer?
Definitely. So, absolutely, I do see it as a human right. John had mentioned the Universal Declaration of Human Rights, and it states in Article 25 that everyone has that right to a standard of living that's adequate for the health and well being of themselves and their family. And, human rights are afforded to us as humans, basic rights and freedoms that belong to every person in this world. And at least they should be. And we as human beings, we can't achieve good health without them, when housing included. And the simple fact is that everyone in the US does not currently have or have access to a standard of living that is adequate for their and their family's health and well-being. And I think a critical piece, again, is achieving, this standard is not solely in the control of the individual. There are structural and social factors that contribute to and limit one's ability to achieve this standard. And, we are human beings. And, I think it's easy to lose sight of that, particularly as we move up through larger structures in society and we get more removed from the experience, like you said, with, having it happen close to you or to you. And, you know, ideally it wouldn't take that to see the importance of this issue, but I think sometimes that is what it takes, right? But I absolutely see it as a human right. We all deserve housing, and we deserve to have a place to lay our head at night and not worry about, our safety while we sleep, or, being, you know, at risk for a variety of different things. And we shouldn't have to worry whether or not we're going to be sick or get sick later in life because of our, what we have in terms of a home or a house structure to live in.
Absolutely. Thank you so much for those insights.
Hmm.
Christy, we're going to come to you now with the big question of the week. Do you see housing as a human right?
Yeah, I was really thinking about this because I think some things we could just say flippantly and think, well, that's the right thing to say. But I almost, like would ask the question more as is it a right for the human? If we believe in each human being, created by God, then it's not just the human right, it's the rights of the human being. And so how can I not actually, want that if I, want the well-being of another person? I mean, absolutely. And it's not just saying that flippantly, as in, it's the right thing to say. And I think sometimes, especially, like me representing the faith side of things, we know like the right things to say, but it's also living it out. It's also taking those steps. So I can't just say it without having my life actually, believe in that and contribute to that in ways for the betterment of another human being. So is housing a human right? Absolutely, because I believe it's the right of every human being that they should, like Zoe said, have a place of safety, have a place of health and healing, and where their environment is where they can sleep at night. And so absolutely, I just don't even I wouldn't even know another way to answer that, to be honest. Like, it's just I don't think I myself would be human if I wouldn't want it for myself. Why would I want that for another? I have to think of it in those terms. What I want for me, do I want that for another person?
Thank you for bringing another fantastic perspective to this conversation, and for just those little nuances and how we word things are really important. So if our communities did in fact view housing as a human right, what do you think it would look like? And Christy, I'm just going to come straight back to you because I think this builds beautifully off what you were just saying. What would it look like if we really did believe and put into practice this idea that housing is a human right?
Yeah. So, and when I was leading my church, and even still today, like I think, it's one thing as a leader, that you believe in it, but if you're not equipping the people that you serve, which, if you're a pastor, you're serving people. And so if I'm serving people, I'm equipping those people that this isn't just me making changes for my community, it's us. And so what that looks like to me is that when you have a whole community around you that really believes in something, that means they'll sacrifice for it, because whatever we value, we'll sacrifice for. So how change looks to me is not just me being convinced, it's me, envisioning other people to want that for other people. And then all of us doing this together. So I think what I've heard from Zoe, what I heard from John, what I heard from the video was that, and this is what I do believe, is that we cannot solve the housing problem by just the church doing it, or just the government, or just health services. This is going to take where all of us come together, and we are, willing to serve alongside, not because we agree on everything, but for the betterment of the human beings that we live, and serve and work around, for the betterment of society. Will we not come together to make this happen and be committed to that? And so that's, I think, how does this look? This looks like all of us being willing to work alongside of each other, not because we agree, but because there's a bigger purpose.
Thank you. And Dr. Freggens, from your perspective, what would it look like if we treated housing as a human right?
Yeah, thank you for what you said, Christy. I think that was all really important. I think, kind of like John, I think had mentioned, fixing housing insecurity and homelessness that plagues us wouldn't happen overnight, right? Especially because of this complexity that we're talking about, and that we all need to kind of be involved in this process together. But I do think that if it was, a shift in culture like that, that would occur if housing was treated as a human right, is needed, and would mean that we are actively on our way to our goal. And that goal being that 100% of people truly have access, or the ability to obtain quality, safe, stable, and affordable housing. And I think, if housing was treated as a human right, it would ideally also mean that we are, or have been, actively taking a health equity approach to housing, like I've described. And of great importance, it would mean that communities and their voices are being heard. It would mean that public health has built and maintained trust within community and with other institutions like academia, like faith communities, all of these things, and that we're working together to make that goal a reality. Health disparities are preventable. In all the ways that housing insecurity and homelessness harm our health, housing security would not only drastically reduce, if not completely prevent, many of those harms, but it would also benefit our health. So it wouldn't just, erase the negative, but it would help us improve. And public health would drastically improve, particularly in combination with continued efforts to address other structural and social determinants. So I think that it's a necessary and important step, and I hope that together we can get there.
Absolutely. As you were just talking about the impacts around health and homelessness, it reminded me of a study that we actually did with UCI in the School of Social Ecology. And we were able to look at what happened to people experiencing homelessness. How did this kind of impact their health once they were able to access permanent housing? And we did see in that study that there were 78% fewer ambulance rides, and 43% drop in visits and stays in the ER. So absolutely, the evidence shows, not just here in California, but the evidence across the country shows, as I'm sure you are fully aware, I am preaching to the choir here, that housing impacts health. Earlier, I'd mentioned the COVID-19 pandemic and how that sort of brought this idea of housing kind of to the forefront of people's minds when it came to health. And so I'd love to ask each of you, from your perspective, do you think the pandemic shifted how we culturally look at housing? Christy, I'll come to you first.
Well, absolutely, because that housing then became, people's work environment. It became, their community. It also, I think, and Zoe might be able to speak better into this, but what COVID did and what I saw is that it brought people's health to the forefront. Like, so mental health, our mental health took a real hit. And so not having a place of safety, as well as we're talking about a pandemic, And then there's just so many layers to it. So did it affect us? Absolutely. Did it affect our mental health? 100%. But it also brought to the forefront those that didn't have a place, because the home didn't just represent where you sleep or where you cook. It also represents where people work now. And so I think it just is another reminder that just how important this is. And this is not, people are not issues. These are, and I think when we look at people as issues, like, or even COVID as a, I think how we approach this, is that we don't just look at it, oh, did COVID create this or make this worse? Or it's more like, okay, it brought to the forefront what was already broken. That's how I see it.
Absolutely. Thank you so much, Christy. Dr. Freggens, what would you like to add to that?
Yeah, I mean, I think that, part of that is what I would have said, and that is that it I think it forced us to see some things that we had been ignoring, bringing them to light in a way where we didn't have a choice but to look them in the eyes, and how do you isolate and how do you, uh, you know, follow various restrictions, preventative measures, and stay home when, if and when you don't have that, if you don't have a place to be, where are you, how are you navigating this crisis? So I think that it did bring to light a lot of issues, and I think, perhaps made some people realize that, uh, I think some people had taken for granted, or felt that, everyone has this, everyone has this home to be in, and forced us to, instead of keeping homelessness and housing insecurity at arm's length, it forced us to see that no, this is happening. It may be happening, it may be happening to you, and kind of really shed light on a lot of gaps in the way that we address these issues.
Thank you so much for that. I would love to just switch gears for a little moment to more of a personal perspective and just ask each of you, what does it mean to you to have a home? And Christy, I'll come to you first.
Well, this is a very personal issue for me on many fronts, if I'm going to be honest. And I think Zoe just said it again. Like until something hits you personally, and it isn't that just true with any area of our life. If it's not what we're encountering, then we tend to it tends to not be so important. But this is a very personal thing for me. So from people that I love that have been homeless, that are homeless, and then even when I went through major life changes and I was faced again where I had stability for 30 years and all of that changed. And so and you don't really realize what you have until you don't, or until it affects somebody that you love. And so it's very personal to me, also in my belief system, not just for me personally, but also in what I believe. And what I believe, whatever we believe is how we behave. So if what I believe about Jesus is true, well then, then my life should be reflecting that in how I operate. And so it's very personal. I can't separate, like when people say, well, that's church and that's, your personal life. I'm like, it all goes together for me. Like, you know what I mean? Like it all is very important. Like I said earlier, like I'm a spiritual being. I believe that. Like, so housing to me is just another layer of, I think it's very personal on so many fronts. And it's just, come, to the forefront of my thinking again for various reasons. And so I think if it was important to Jesus, it's got to be important to me.
Thank you, Christy. Dr. Freggens, how about you? What does having a home, or what does home mean to you?
So I think a lot of things. One, as a queer woman, it means being in a place where I know that I'm safe. Um, and, not just literally from, the outside world, but, with my wife and with my family. So I think that it is something that provides, you know, an undeniable sense of security. And I if I didn't have that, I don't know how I, um, I don't know what I would do. So having that helps me get up in the morning and helps me do everything else, and not just in the literal obvious ways. And in situations that, when I was young and had an experience where, there was threat of losing our home, it, made me realize that, like, when you're young, you grow up, you're in a situation, if you have, secure housing, and you think that that's something that everyone has, and that, like Christy said, you don't really know until maybe you, um, realize that it's not, it can go away, and you can't always control it. It's not always within your control. There's a lot of things, a lot of factors that can affect, you know, that having that place of home in both a literal and, personal um, sense. So I think that when thinking about the literal pieces, having what you need to have the ability to have good health and to be safe, that is definitely part of that definition. But I think the other part is being in a place where I can, be myself and not fear any kind of reprisal, and know that I'm loved and I'm going to be okay.
Absolutely. And thank you so much to both of you for sharing, from your own personal experiences, the importance of having a home. I can certainly relate. I have been a homeless advocate here in Orange County for a number of years, and I started our homelessness 101 curriculum that we've run here at United Way. I started that in a former role, a former place of employment, and I used to talk all the time and teach all the time about the fact that homelessness could happen to anyone. And then through some life circumstances, I found myself with nowhere to go. And I found myself, without that stable, safe roof over my head. And it is pretty, remarkable that homelessness does not discriminate. Homelessness really and truly can impact anyone and everyone. And it is in those moments, where you really realize the importance of having those four walls and a roof around you to provide you with the security and the safety that you need to be a fully functioning human being. So thank you for sharing vulnerably and bravely to each of you around the importance of housing. I do know that talking about housing as a human right can be viewed as controversial. It's a difficult discussion to have. Do either of you have thoughts on why this can be a challenging discussion to have, and what we might be able to do to help make that easier? And Dr. Freggens, I'll come to you first.
Sure. I think a big part of it is um, that when we look at the reasons why um, everyone doesn't have secure, affordable, safe housing, it forces us to understand and acknowledge some things about our society and the history in our society that don't feel great, And I think we don't, as a society, like to confront some of those things. Um, and so I think that's part of the reason. I also think, excuse me, that it's very easy for things to move into a political realm and then kind of get complicated and, um, separate from the issues that we're talking about at hand, and, the just the basic human need shelter. And so I think that's a big part of it. And I think one thing to do is to um, engage with community, talk to people, have these conversations, and keep doing them. And hear people's experiences. And by having those conversations, I think those conversations will get easier, so to speak.
Thank you. Christy, anything you'd like to add to that?
Yeah, I think, like when we think about homelessness, I think it scares people. I think if we're really going to be honest, I think when we hear things that seem overwhelming, or that it's a problem that's never going to be able to be fixed, I think it's so overwhelming for to look out for some people that they're afraid of it. I also think that there's misperceptions. I think we have to start telling stories, because there's assumptions that because someone's homeless, then they're unsafe, or they're an addict, or they're going to kill you. Like, I mean, just practically speaking, I think there's some of the misperceptions. And so I think we have to tell stories, because that's not accurate, and it's really, really hard. I have found, like, it's really hard to hate people up close. And when you hear someone's story, it just personalizes it. And so I think some of the misperceptions, like those things, have to get broken down, because when there's a fear of something, we tend to run from it. And then nobody wants the responsibility of it, because then, like, then it fails on their watch. There's lots of different reasons, but I think how we change some of this conversation is we start telling stories. Because I think when we start realizing the statistics, and help you, and not worry so much about what got people to be homeless in the first place, like we've got to like some of those things, like that's not really the issue. Like, it's more like, kind of approaching things from a story perspective, rather than a fear and assumption. I think that'll be helpful. I think, because like I said, it's just hard when you know somebody's story. You tend to be like, oh my gosh. And I do think when it comes to homelessness, there are assumptions that are just not even statistically accurate.
Absolutely. Thank
Absolutely.
you for touching on that. Yeah, there are definitely a lot of misinformation or presumptions made around why people fall into homelessness. And that's certainly something I know I referenced it already, so I apologize for referencing the same study twice in our discussion. But the study that we did with UCI, the top 3 reasons that people fall into homelessness, the first 2 are economic. This is a very expensive county to live in, and wages just have not risen to match the level of housing costs. And so those are the top 2 reasons. And then the third reason that people fall into homelessness here are family issues and family dysfunction. So death of a spouse, divorce, separation, and abuse. We heard earlier John talking about, the impact of domestic violence. And so those are the top 3 reasons that people fall into homelessness in our community. And so thank you for bringing that up. Any chance I get to try to debunk that myth around what causes people to fall into homelessness, I always want to be able to provide some accurate information there. So this has just been an incredible discussion, and we have packed a lot of information into this chat today. So, and for your closing question, what are your kind of final thoughts? What's something that you want to leave people with today? And Zoe, I'll come to you first.
I think when you look at these issues, like we said, they're complicated, and the intricacies, and the lift that will need to take place to bring us all together, it can feel really overwhelming. And I think it's important that we take a moment and take a breath, um, and remind ourselves, this is going to sound simple, but remind ourselves that it's going to be okay and we can do it. Because I mean, that's what I believe. I think we can, I think it's possible. I think it's gonna take a lot of work and a lot of people and, acknowledging things that maybe we haven't in the past, taking all of these things that we've talked about today into consideration. So it's hard and it's not easy, but I do think it's doable. So I think when we start to feel overwhelmed, we have to take a moment and take a break. And it doesn't mean you're giving up. It just means that you have to take care of yourself and, get rejuvenated. So maybe have these conversations, keep having them. Don't lose that momentum in that sense. And, and yeah, I mean, I'm going to keep doing everything I can. But I also, we all have to take breaks too. So I guess don't give up hope. I know that sounds cheesy, but I know that that's what helps me keep going.
Thank you for that. Christy, how about you? Any last thoughts?
Yeah, and thank you for that, Zoe. I think that's important. And when I think of like if I have to do something that's really big, and this is a big deal. This is something that this is like we've all kind of said, reiterated. It's going to take like all of us coming together. But when I think of like I have to do something that's so big that I cannot do it, I don't think of like the end result. I think of the next step. So that what's the next step that I need to do? And that sort of leads to the big result. So the next step is like, well, first of all, we've had having these conversations. The next step is, we get into the same room. I do want to say for those that are listening and you're like, this is important to me. Like, I don't have a place to live. I think that to connect and find the places that you can get help with your mental health, or you can get information about housing. I think we've got to say that for this because those I know will be listening, and I think that's really important. But I would just say, like, let's just do the next step. Let's keep going forward. Let's keep doing the things that are necessary, and then it tends to lead to the fulfillment of what we not only like to see but need to see.
Well, thank you so much. And a huge thank you to Regional Administrator Jason Prue for his remarks, to John Gould, to you, Christy, to you, Dr. Freggens, for joining us today. And thank you to everybody who's tuned in. If this is something that you are interested in taking a deeper dive into, I'm really excited to let you know that we have some in-person opportunities throughout Orange County. So tonight we're going to be in Fountain Valley at the Artisan by 7 Leaves and Crema Bakery from 6 until 7, having a guided discussion around housing as a human right. If you can't make it tonight to Fountain Valley, don't worry. We're going to be over in Fullerton tomorrow morning. From 9:30 until 10:30, we're going to be at Pilgrim's Coffee House, and I'm sure the links for these are dropping in, so you are able to register. If you don't make it on Friday, don't worry, we have something for you on Saturday. So Saturday, we're going to be in South County from 9:30 until 10:30. We're going to be in Mission Viejo at Ziggy's Coffee. And then if you don't make it there, don't worry. The final day of Hunger and Homelessness Awareness Week, we're going to be at the Arvida Book Company in Tustin from 4 until 5. And that one, we're really thrilled that our Faith Leaders Council of United to End Homelessness have put that discussion together. Lots of resources available on the United to End Homelessness webpage for this year's Hunger and Homelessness Awareness Week. We really hope that today was helpful for all of us on our journey of looking at housing as a human right. There is an exit survey that's going to pop up. We would love your feedback on this, so please do take a moment to do that. And just once again, this event and this week's campaign was pulled together by 26 different agencies in our community. And so we are incredibly grateful to all of those. There should be a QR code that will pop up on the screen that'll take you directly to the website should you wish to learn anything more. And once again, thank you so much to everybody for tuning in today. And this brings us to the end of our event. Thank you.